Hi guys, welcome to our channel Med School. This is our first ever seminar in this channel, and hoping you all like it. And the first topic is yellow fever from the microbiology. Reference is from Apurva Shastri. So first, learning objectives include introduction, epidemiology, transmission, clinical manifestations, lab diagnosis, treatment and prevention, and vaccine. So first, we have to know a little basic things about yellow fever, right? So, what is yellow fever? It is an acute febrile illness. It is an arbovirus, belongs to the family Flaviviridae. So, it is an enveloped virus containing a single stranded RNA. So, it has a single stranded RNA and it is an enveloped virus. Epidemiology. First, the yellow fever virus, it is very endemic in West Africa and the Central South America, and in the rest of the world it is not found, including our India also. And every year there are about 2 lakh cases of yellow fever have been estimated, and in those 30,000 deaths annually occurring worldwide, and majority, that is 90%, is from the Africa, and all age groups are susceptible. Um, there are 7 genotypes of yellow fever viruses have been identified till now. So first, transmission, how it transmits. So our humans get the infection by the bite of Aedes aegypti or the tiger mosquito. There are about two transmission cycles. It is the jungle cycle and the urban cycle. So jungle cycle is between the monkeys and the jungle mosquitoes. Urban cycle is between humans and the urban mosquitoes. Clinical manifestations. So first, the yellow fever virus has an incubation period of 3 to 6 days. And after these 3 to 6 days, there are about symptoms. Like early stage symptoms include fever, chills, headache, dizziness, myalgia, and backache, followed by nausea, vomiting, and relative bradycardia. In some of the people, that leads to severe cases. So the severe cases are classified by or characterized by uh, they have hemorrhagic manifestations, platelet dysfunction, liver involvement, that is hepatitis. So, what are the features of hepatitis or the liver involvement? Includes there is a midzonal necrosis and intranuclear inclusions inside the hepatocytes called as Torres bodies and the jaundice. And the last is fourth one is the renal dysfunction. We can say encephalitis, but it is a rare cause, rare clinical manifestation. So, in severe cases, there are four characteristics. We can see hemorrhagic manifestations, we can see platelet dysfunction, there is a liver involvement, and the renal dysfunction. So you can see symptoms like sudden fever, yellowness of the eyes or dark urine, body pains, headache, and I said no, hemorrhagic manifestations like bleeding from the nose, ear, mouth. And how do we prevent? So we can prevent by taking vaccination or wearing protective clothing to prevent mosquito bite, sleeping under a long lasting insecticide treated net, get rid of stagnant water, and keep water containers covered. These are the preventive measures. So what is the lab diagnosis? So there are of two, serology or molecular method. In serology, first we see IgM ELISA. It can be done after 3 days of onset of symptoms. If the IgM ELISA is positive, it should be confirmed by a more specific test called as plaque reduction utilization test. Or otherwise, we can use molecular method like RT-PCR, reverse transcriptase polymerase chain reaction. In this, it detects specific viral RNA, that is NS5 region in blood, and it is more confirmatory than serology. And treatment. Treatment is nothing but a symptomatic care. So if we get a fever, we have to treat by anti-inflammatory. Next, prevention is by vaccine and mosquito control. Like in this previous slide, we have to use protective clothing to prevent mosquito bites, sleeping under a net, or get rid of stagnant water, and keep Keep water containers covered like this. Next, vaccine. The vaccine we are using now is yellow fever 17D vaccine. We have to know more about this because it's very important. Yellow fever. It is a live attenuated vaccine and it is prepared from allantoic cavity of chick embryo. So the people who are allergic to chick embryo, allergic to egg, like, so they can't be taken this vaccine. Dosage is single dose and it is given subcutaneously, and a strict cold chain has to be maintained during transport, that is between minus 30 degrees Celsius to plus 5 degrees Celsius, and it is available as a lyophilized form, and it has to be reconstituted before use by using diluents. So such diluents are physiological saline, and after reconstituting, we should use within 30 minutes, and the vaccine is effective within 7 days of administration and protective for about 35 years. So contraindications. So children less than 9 months and in pregnancy and in HIV infected people and people with allergy to egg yolk, all in these conditions we should not use. And if a person is taking a cholera vaccine and he wants to take a yellow fever vaccine, a minimum of 3-week gap should be maintained. Validity. A certificate is issued after vaccination and should be renewed for every 10 years. Should be recommended during international travel. Thank you. We are hoping you like this video. Please like, share, and subscribe to Med School. Bye bye.